From the News Channel 5 Network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here. It is Tuesday. It's cold out there, but you know what? It's going to be even colder tomorrow. Either way, you stay inside. Join us in the program this morning, and we'll take your phone calls. We'll talk about a topic that I think affects us all one way or the other sometime during the year, or if something happens to you. It can be seasonal. Anxiety, depression, those types of things. A lot of folks just weathered some of that through the holiday season. Others, like myself, as we head into the final 2 months, the really cold months of winter, that always is kind of a struggle for me to get through. And we're going to talk a little bit about that, dealing with getting through that, how you can do so, and also about an organization here in town that deals with this on a lot of different levels, not just for folks like you and I, even though you're welcome to call the show this morning, 737-7587. But hearing about how this also helps us in general in our community if we deal with these types of issues with folks that maybe have problems that end up putting them behind bars or in court for whatever things happen. We're going to talk about that this morning with Jasmyne Lyons, and she'll do a much better job of explaining it than I do. Good morning to you, Jasmyne.
Good morning.
It's a pleasure having you on. Now, it says here you're a psychiatric mental health nurse practitioner. You've been doing that for over 2 decades, right?
I've been a nurse practitioner for over 2 years.
Okay, nurse practitioner, but dealing with, you were saying you and your mother.
Me and my mother.
For 2 decades doing what?
So beforehand, I have my master's in counseling psychology, so I was actually a therapist, and then I moved forward to become a nurse practitioner.
I got you. Okay, but a therapist dealing with mental health issues?
And dealing with mental health issues in the community.
And as you did that, you and your mother then decided to form Transformation Services.
Correct.
How did that come about?
So I worked in a community agency, my first job, StreetWorks, which is a community agency that deals with individuals who are positive for HIV. And that was my very first job as a case manager. And I decided that the helping profession was the profession for me. I loved it. It was natural. It was easy for me to sit down, talk to somebody, figure out what was going on, give them some leeway for them to have somebody to talk to. And I said, you know what, I can do this. Yeah. I can do this. And my mother had been doing that for about 5 to 6 years. And after I started, then I decided that I wanted to be able to do this on my own terms, see people that I wanted to see the community, help the community, and then also I did a lot with a lot of my patients at StreetWorks. They were dealing with the jail system. Yep. And I realized that there was some break, there was some gap, there was not a continuing of care. Once they got to the courts, it seemed as if there was nothing there to help them with their mental illness. It was all dealing with the behaviors that got them to court. So me and my mother decided, you know what, there's a need, we have a specialty, we know what we're doing, let's open up and let's form a business that can actually help people who have that need, who have mental illness, who go to courts and who don't have an advocate or support system. Absolutely. You know, I was telling you before the show, mentioning to her that Sheriff Darren Hall comes on this show every month, and he'll tell you that his jail and most jails are full of folks dealing with 2 issues, drugs or mental illness, and quite often both. And he said, you know, part of the problem is exactly what you said. There were not enough services. There was a need to help these folks deal with the mental illness, because if you don't deal with it, once they get out, they still have the same condition, and they may end up reoffending and back behind bars. Absolutely. A cycle. Now, it says here that, you know, you address the stigma of mental illness, which I think I understand. I'll let you elaborate on that, and then helps normalize it. When you say normalize it, does that mean helping find a way to live with it, helping find a way to treat it? What does that mean? Both. Okay. When I say normalize it, a lot of individuals have symptoms of a mental illness. Everybody has maybe a bout of depression, or they get anxious about something. It may not interfere with their daily life, so it may not become the actual disorder, but a lot of people do not like to say, I have a mental illness, or I need help. There's stigma, because of the stigma, right? Because of the stigma. So normalizing it for us means letting everybody in the community know that it's okay to be all right with the fact that you have some symptoms, to come and get help. 2 out of 3 Americans do not come and get help with the mental illness. And so normalizing and allowing everybody to know that it's okay, I have it too. I experience this as well. You experience it. It's okay to get help. That's where I want to get into this, and that can be the bulk of the show, where we can also take phone calls depending on how you're feeling. The question is then, how do you know, obviously if you've gotten in trouble and you're going through the court system and a judge
orders, and we can talk about some of how you do that you seek help, then you have to. But let's just say someone who's watching this morning, how do you know whether or not you're someone that needs help, or if you're just feeling maybe some natural blahs, like I am a bit after the holidays as you get back into the cold January days? I assume for me that's kind of normal, and I expect it to lift at some point. How do you know whether you're feeling anxiety or when to seek help?
So the major component to know that it's time to seek help is time frame. When something is lasting over 2 weeks long,
2 weeks?
2 weeks long, that's when you know that it is interfering with your daily living activities. I tell people all the time, think of natural. You're just feeling sad. You're feeling that blah. That's what people first think of when they think of depression or anxiety. But it also can be atypical. You can have irritability. You can have anger. You can have too much sleep, too little sleep. You can eat too much. You cannot have any appetite. Your energy level is extremely low. Concentration, you can't focus on much of anything. Those are the symptoms of depression. Anxiety, you're just generally worrying about a lot of things that you can't control. You're having those physical symptoms, chest palpitations, sweating, trembling palms. You have maybe a panic attack, and you're just having those symptoms for a consistent time period of 2 weeks or greater. Then you know that it's time to get help, because everybody has a moment where, you know what, today was a bad day. I don't feel good today.
Right,
but if it's consistent for at least 2 weeks, then you know it's time to get help.
And it can be, now when you say consistent, can it be based on no real reason? Or let's say if you're still feeling lousy over perhaps something that a lot of people would, a death of a loved one or something like that, that's normal that you're going to have a grieving process and you might feel lousy for a couple of weeks. Are there things you can do to help yourself feel better during that normal period? Or is that different if you have something really tangible that's making you feel bad? Like maybe you just lost your job, you're unemployed, you're having trouble paying the bills, and every day you wake up and feel that same blah way.
Right. Now the thing about it is everybody feels some certain way because of the situation. Situations trigger those. It is what we do. There's a thin line between a patient coming into my office and a person staying on the streets, and that's the coping skills. As long as you're able to cope and you are able to function daily, then you are okay. But when you start to interfere with you going to work, you just don't feel like getting out of the bed, you don't feel like doing the things that you normally do and that make you happy, then that's when it's time.
See, that makes sense. You're the first person to ever kind of, I would always think, all right, that doesn't mean that you won't still have that on your mind, that yes, I'm unemployed and I feel lousy about that because I can't find a job right now. But if you're still able, you may have a little trouble getting up, going, oh, I hate to search, but you still get up and do it.
You still get up and do it.
Then at least you're functioning. It gets your attention when someone's to the point where they've started shutting down.
Shutting down. Not doing the things that they like to do. The first thing I ask people are, you have friends? Okay, you do? You don't? If you don't have friends, why not? When's the last time that you went out? When's the last time you went to the mall? Do you still hang out? Do you go to the movies? Do you do the things that used to make you happy? And when they say no, then that's when it's interfering with their life.
What if they say they do the things that can make them happy, but they still feel this constant, maybe sadness in the backdrop, but they're still functioning? They find moments that are pleasurable during the day, but no matter what, when there's a downtime, their mind just goes to, whatever, blah.
So as far as, having the feeling of the blah, the things that you can do are natural remedies. Exercising. Exercising basically helps put happy endorphins in our brain. Getting out and finding a hobby. Finding a hobby of something that actually engages your concentration, makes you think. And then too, I tell a lot of individuals there are two ways to treat, and it's either psychotherapy or medication. And I feel like if you are one of those individuals that it's not really medicine, the chemical imbalance is really, I'm just kind of down, I still have that blah feeling, you may need to build that toolbox. You may need to find some better coping skills. And that is where therapy comes into play, or where talk therapy or group therapy.
And that's what you guys do.
That's what we offer.
At times will you come across individuals that benefit from that, but maybe you determine this person might need some medication to augment it. Now you're not a doctor in that way. You don't prescribe that. Would you send them to someone to do that?
I actually prescribe.
You do prescribe psychosomatic drugs and things like that, right?
As a psychiatric nurse practitioner.
Oh, so you can prescribe. See, how awesome is that? Now, and the thing is, all right, so how often, what will determine in your mind whether or not someone needs Prozac or something like that?
So When a person comes into the office and we have our first session, what we're doing is we're realizing, or we're trying to determine history. Previous history of mental illness. How long has it been going on? And then what have you done to help yourself before?
Right.
In our field, it's never new. Mental illness isn't new. A lot of people don't come in for the first time and say, you know what, I felt sad last week and this is my first time having this feeling.
They've been dealing it for a long time,
For a long time. And so what we do is we kind of go over the options. Of course, therapy is always an option, but sometimes I tell people we have that chemical imbalance. And if we feel stagnant and we feel like we aren't at baseline, then medicine helps us get there. And there are three areas to me. You have your baseline, then you have your low, and you have your high. And I tell people all the time, when we're low, we need to get to baseline. And medications normally get us there. And then therapy helps us to cognitively process those thoughts and get us high.
But the point is, and I think that's a great thing to tell folks, is that you're not drugging someone up. What you're trying to do is whatever drug you're giving them is hopefully getting them back to normality, the baseline.
Absolutely.
And people need, because I've heard more than one person say, well, I don't want to do that. I want to take a pill. I don't need to be drugged up. Because I'm saying that's not the issue here. The issue is getting you to feel what a normal person, what you normally should feel like, baseline.
Absolutely.
And then it's awesome. All right, listen, we'll take a break on that note. When we come back, I mean, there's a lot more to talk about. Depression, not just in adults, but children as well. And some of the treatments. And that was our first segment to kind of lay out some of the basics. Obviously, she knows what she's talking about. The number 737-7587. If you're dealing with some of this, or if you have a story to share with us, and I want to hear some of yours maybe that you can tell us in general about some of your patients and how it's gone, give us a call. We'll be back with more right after this. Stay with us.